Hey, my name's Brittany Arender, and today I'm going to be doing my mixing and administration of insulin checkoff. So the first thing I'm going to do is pull up my physician order and the MAR, and I'm going to compare them two together. The patient has an order for regular insulin and NPH insulin. I'm going to then identify my patient, which I've already done, and perform hand hygiene and put on clean gloves. I just checked my patient's blood glucose level and it was 252. I'm gonna assess my patient's readiness to eat, explain to them that they will need insulin, and then I will verify which site the last dose of insulin was given in and assess their skin integrity. I am going to pull my medication and check that against the MAR, and I'm also going to check the expiration date and roll the medication. So based on my patient's blood glucose reading, the doctor ordered 6 units of regular insulin and 16 units of NPH. So altogether we'll be given 22 units of insulin. So once I've done that, I'm going to take an alcohol swab and cleanse each vial with a different alcohol pad. So I'm going to inject 16 units of air into my NPH vial first. I'm going to be sure not to touch the needle with the solution in the bottle. And then I'm going to be withdrawing or aspirating 6 units of air for my regular insulin vial. And then now I'm going to pull, so we're going to do clear over cloudy. So I'm going to pull 6 units of regular insulin. Okay, so once I've done that, I'm going to make sure there are no bubbles. Okay, now I can pull my cloudy, and I'm going to be doing 16 units of cloudy, and then should have, and we do, a total of 22 units of insulin. I'm going to expel the air bubbles. And then once I do that, I'm going to recap. Okay, so if I was outside the patient's room, I would label this, but we're gonna say I'm in the patient's room. But before I give this medication, I have to get a second nurse to verify. So I'm gonna call over a second nurse. There's no one here to verify today, but I'm gonna make sure in real life that I would have a second nurse verify that this is the correct amount. So after that, I'm going to go into the patient's room and explain to the patient that I have an order to give them some insulin, and I'm going to identify which site. So I'm going to use the patient's abdomen for purposes of this video, and this is their abdomen. I am going to cleanse the area in a circular motion. And I'm going to let that dry. And then once I do that, I'm going to pinch about, for this patient, I can get about 2 inches of sub-Q tissue. So I'll go in at a 90-degree angle. If I couldn't get 2 inches, if I could only get like an inch, I would use a 45-degree angle. So I am going to go in at a 90-degree angle, and I'm going to slowly administer the medication. I am going to withdraw, put that in a sharps container, and press an alcohol pad to the injection site. So again, I did not recap that needle, put it in the sharps container. So after I gave my insulin, I'm going to remove my gloves, wash my hands, and I'm going to document. And that's it.